Botox is the #1 cosmetic procedure in America, and it is very, very safe. And there is a very, very high satisfaction rate. 98% of patients that have Botox are really satisfied. And it's also the most studied medicine in the world.
The most common places I do Botox with my patients are for the angry lines, the forehead lines, getting that all nice and smooth, and around the eyes. Just softens the smile lines.
You may be wondering how Botox works. Botox works by decreasing muscle contraction in the face to reduce and lessen lines and wrinkles.
Both men and women come in for Botox regularly, and they use it just for, we all want to look refreshed, we all want to look like we just got done with vacation and that we're not furrowing, and we're just all want to be beautiful. People use Botox for many reasons. One reason people use Botox is for prevention. And I always use the example of if you crinkle paper over and over and over, eventually it's going to have a permanent crease. And so we use preventative measures, Botox, to help keep the skin youthful. Also, it also gives a restful look. It's quick, it's easy. People do what we call drive-by Botox. They stop in real quick, get their Botox, and then they go back to work.
Other uses for Botox that you may not know about are for excessive sweating of the underarms, hands, and feet, and that can last about 9 to 12 months.
Botox is an FDA-approved product. It has been around for almost 40 years, and it was an accidental discovery when it came to aesthetic purposes after being used in ophthalmology. In ophthalmology, it was used for different lid, it's called a blepharospasm, where it's uncontrollable blinking. So as they were using it with that, they noticed that the wrinkles were going away on the outer portion of the crow's feet. And so what happened is Allergan started doing it for therapeutic purposes, more on the therapeutic side, but then it got an indication through the FDA for aesthetics. So that's where they're able to, our doctors and nurses are able to inject a patient to reduce the little lines, which we call 11s, in between the eyebrows.
Hi, I'm Ellison. I'm one of the nurses here at Derma Health and one of the corporate trainers. I suppose you're probably wondering about the safety of Botox. I think that probably my best advice to you is to say, find a provider that is very experienced, has been doing it for a while. We at Derma Health are the #1 provider of Botox in the West. When you're considering Botox for the first time, or even if you're thinking about changing providers, you want to do a little bit of research. You should choose a company or a provider that has a good reputation. Someone that does a fair amount of Botox. You don't want to go to just someone that just only does it 1 day a week or for 4 hours a week. At Derma Health, we do quite a few injections of Botox. We are a double black diamond provider of Botox. You should also go to a company where when you go in and you meet with your provider, they ask you questions about your health history and what kind of medications you're on. They should hand you a mirror and ask you, where do you want to have your Botox? What are you considering? They should take your concerns and your feelings into the situation.
So when you look at how much, really how much does Botox cost? And I think that's one thing that you need to come in and we can talk to you about that, because relatively speaking, it's about $200 to $300 per area, depending on how strong the muscle is that needs to be relaxed. So if you look at it, it's maybe cutting out a latte a day when it comes to every 3 to 4 months to be able to get your
treatment. You should choose Derma Health for Botox. We will provide you with a treatment that is safe and effective and is designed specifically for your needs.